Good afternoon, Miss Thomas.
Hi.
Congratulations. And we're going to discharge you today.
Okay.
All right. So, how are you feeling?
Very good.
Wonderful. So, what I would like to go over with you is your discharge instructions, some important information we're going to go over, okay?
Okay.
Now, since you did have a C-section, you have to make sure you clean that with warm water and soap and just keep it dry. And rather than rub the incision, pat dry the incision. And those tape strips should take about a week to fall off. Now you should be able to return to normal activities in about 6 weeks. And just between those now and those 6 weeks, try not to lift anything more than 10 pounds because that could cause your incision to split open. Then you have to come back to the hospital. You should also refrain from sexual activity during the 6 weeks because it can make you bleed a little bit more. And don't put anything in your vagina for now, such as tampons or even douching. So allow 6 weeks to heal. You have any questions about that part? Okay. So you're going to notice lochia is going to be a dark red, and then, but as time goes on, that's just a regular vaginal discharge. And as time goes on, it should get lighter and lighter. And that's also going to be between those 6 weeks period. Now, important information, the most important thing right now is your bleeding. So if you notice that you're soaking a peri pad more than one every hour, that could be you having some bleeding issues, okay? So also, if you notice your vaginal bleeding does not stop or slow down, if your skin gets pale, if you have blurry vision, dizzy, and you just don't feel right, those could be exacerbations of the bleeding, okay? And then, so you have bleeding, and then you also have to be concerned with high blood pressure. And that could happen if you experience like a headache, your face and your hands and legs are swelling, and then all of a sudden you weigh yourself, you gain a pound or two over one day, and you know when you just look more bloated and full of water, then that could be, what I want you to do is call your doctor. And if you can't get in touch with your doctor, if you notice heavy bleeding or headaches, I want you to call your doctor. If you can't get in touch with them, go to the emergency room or call 911, okay? So far, so good?
Mm-hmm.
So if you have any pain medications, don't drive or operate heavy machinery, of course. And so you should probably be on those narcotics for about 2 weeks, or any pain meds for that matter. And we also don't want you to strain when you are using the bathroom, because that can also exacerbate your wounds and stuff like that. So just follow the doctor's order regarding any laxatives or stool softeners. And every time you go to the bathroom, wash your hands, of course. Wash your hands even before you breastfeed and before handling the baby. Also, when you look at your wound, if you notice any discharge under your wound, like it smells or it's like white, puffy, pussy discharge, then contact your doctor again. So headache, but heavy bleeding, or your wound has discharge. All those cases you need to call the doctor. Okay. So your breast's going to be tender, and it's going to be full. That's normal. So to kind of help with the pain or discomfort, you could take a warm shower or even applying a warm towel to your breast to help with comfort. And so you want to also feed your baby frequently, and when you feed your baby, alternate breast, of course. And be sure the baby has a proper latch on your breast nipple. Their chin should be touching your breast, okay? All right. And then in between feedings to help with the discomfort, you can use a nipple shield, and you also should pump at least 6 times a day, 15 minutes on each breast, so 3 and 3. Okay. Now, there are signs you can look at the baby. The baby should be eating about 8 to 12 times in a 24-hour period. So you either like every 3 hours or every 2 hours. And you know your baby's full when he's calm after feeding, and within about 10 days to 2 weeks, he should regain his birth weight, and then as time goes on, he should be gaining about 5 to 7 ounces week by week. Okay. So far, do you have any other questions about the breast and care and feeding? Okay. Now, you also can apply ice bags to your breast at 20-minute intervals if you feel in pain, okay? But it may take some time to get used to. And just remember, take care of yourself. Take frequent breaks. You should try to nap when the baby naps. And for the first 2 weeks, concentrate. I know there's a lot going on with the newborn, so just kind of concentrate on taking care of yourself. And then let your friends and family help around the house. Now, of course, having a new baby is overwhelming. So do not, I'm just going over this information because it does happen. Do not shake the baby. If the baby is constantly crying and you can't calm the baby down, take a deep breath, count to 10, because the babies can suffer from shaken baby syndrome. It's a type of head trauma, and oftentimes the caregiver or parent hits the baby or shakes the baby or slams the baby down. So we don't want that. So take your time, don't get overwhelmed. Put the baby down in the crib and then just take a 15-minute break. And if you still feel overwhelmed after the 15 minutes, call your friends, call a family member. There's even a hotline that you can call for emotional support. It's provided in that book. All right. And then also, if you notice that you're crying a lot or there's sadness, this could be a symptom of serious mood disorder, postpartum depression even. Like these feelings, you're angry, irritable at the smallest things, you don't show any interest in your baby, loss of appetite, and sometimes these signs you don't necessarily recognize yourself. So if your husband tells you that you're feeling, you seem sad or you're not showing as much interest, take that as a clue. It's nothing to be ashamed of having postpartum depression. So in order to reduce the risk of sudden infant death syndrome, give your baby supervised tummy times, turn them on the baby, and then breastfeed as long as possible, attend the well baby checkups, and while they're asleep, use a pacifier once you get accustomed to breastfeeding. That also is shown to reduce the risk. Didn't even know that. So pacifier at night. And obviously don't
reduce the risk of what?
SIDS, sudden unexpected infant death syndrome. Yeah. And do not smoke or vape in the house. Now you'll notice that the baby's breath is sporadic. They can take as long as 15 seconds in between breaths, so that's normal. But if you notice like the baby is blue or lips are blue, then that could be a sign of some respiratory issues. They build up mucus, so you want to have that suction, the bulb suction around to clear that out. All right. So health-wise for the baby, you can check their temperature 1 or 2 ways. Matter of fact, it's most convenient just placing the thermometer under their arm, right in the middle, so take the little silver tip and you just put it, and then you hold their arm down like this. Okay, and then wait till it beeps, and once it beeps, that's the reading. Anything over 99 degrees is a fever, right? And then here's some warning signs that the baby could be ill, like they're extra sleepy. You see yellow eyes, yellow skin, they're constantly crying. Their stools look like pebbles, vomiting, obviously. Then these are situations where you want to call 911 or go to the emergency room. And that leads me into talking about jaundice. Now, usually, it's possible that a baby can have jaundice. It just basically means it's the breakdown of red blood cells. But it be so many that the body can't keep up with it, excreting it and getting rid of it through the urine and stool. The baby may turn yellow. And so the eyes, lips, and everything will be yellow. So, but so yellow. Yep, and that's also a 911 situation. All right, so let's talk about taking care of the baby. So just keep the umbilical cord clean and dry. You don't need to pick at it or do anything. It's just gonna naturally fall off in a few weeks. And just keep the diaper below the umbilicus. And then if you notice any redness, same with your incision wound. If it's red, like the cord, if it's red, there's a pus drainage out of it, then it could be a sign of infection. And that's also where you want to call your provider. And then wet diapers should gradually increase. They should be passing their bowels at least 3 or 4 times a day. Like I said before, their feeding should be every 2 to 3 hours. And then, so that's the feeding. And usually breastfed babies have a yellow seedy stool, so that's normal. All right, let's move on to car seat. So car seats, when you place the baby, it should be snug, but not too tight as to restrict their breathing. Don't put in too many clothes, puffy clothes on the baby, because you do want it snug. And if you feel like the baby's cold, you can just place a blanket over the car seat. Okay. All right. You have any questions so far?
No.
About, okay, baby. Okay, so babies sleep about 11 to 19 hours a day. And when you put the baby in the crib, you shouldn't have anything else in the crib. It should be a firm mattress. And also, we recommend, if it's ideal, to have you sleep in the same room as the baby for at least 6 months, preferably 12 months, same room, but just not in the same bed. Yeah, you know why? Do you have a question about why you can't sleep with the baby? In a second.
SIDS.
Yeah, SIDS, exactly. Yeah. Or even sometimes you may be sleeping and roll over on the baby. Baby can also fall off the bed. So that's just a safety concern, right? Okay. So as far as like grooming a baby, you notice that your baby's nails are really small and they're really soft. So don't cut their nails, because if you could cut your nails, you can cut their skin and they'll start bleeding. So you could just get a nail file and just file the nails down. So don't do what I did. I used to just bite them off by the finger. So don't do that. Just use your nail file. Let's see. And then when you bathe the baby, gather all your supplies first. Like you're gonna need washcloths, like 2, a towel, and use mild soap. And then bring the clothes too. And then wrap the baby up. And then as you will clean it, you start with the head first and work your way down. Wipe the eyes from the inside to the outside. You know, you don't want to use soap on their face. And then when you get to their body, you can just wipe that down, wipe it down. And then immediately, as soon as you finish taking a bath, wrap them up again, dry them off, and take them into the warm room. Or you could just snuggle with the baby, bring their temperature, or regulate their temperature, since you just expose them to the water. Now, your baby's also been circumcised, so don't need to do anything extra. Don't try to pull back the foreskin or anything. Just keep it clean, keep it dry, and then if it's a little red, that's normal. But like the same thing before, if it's drainage or it smells funny, call 911. So anything that smells funny, look funny, other than a little slight redness on the penis, that's normal. And here's a good way to remember your following checkups. It's going to be the first month, the second month, fourth month. So 1, 2, 4, and then 6, 9, 12. Those are your routine follow-ups. So 1, 2, 4, 6, 9, 12, and all of that is in that book. All right. Did I go over everything you wanted me to go over?
Yeah, I think so.
All right, fantastic. Well, I'll go get that wheelchair for you, and we'll get your stuff gathered. And congratulations once again.
Thank you.
Thank you.